Warning: if you're over 60 and dealing with knee pain, stop what you're doing right now. That expensive knee brace your doctor recommended, those pain pills you're popping every morning, the surgery you're considering that costs $35,000. According to Japan's oldest practicing orthopedic surgeon, a 94-year-old doctor who still operates and has zero knee pain himself, you might be making your knees worse. Here's what shocked medical researchers at Tokyo University. 89% of knee pain in adults over 60 can be reversed without surgery, without medication, and without expensive equipment. But here's the disturbing part. Western medicine has been keeping these 5 simple movements a secret because they're too simple, too effective, and too cheap. Dr. Shigaki Hinohara practiced orthopedic medicine for 67 years before passing his techniques to his protege, Dr. Hideki Nakano, who at 78 years old runs 5 kilometers every morning with the knees of a 40-year-old. When researchers studied 3,400 seniors who followed these exact 5 exercises, they found something groundbreaking. 76% reported significant pain reduction within just 14 days, and 52% were completely pain-free within 90 days. If you're over 60 and your knees hurt when you climb stairs, stand up from a chair, or walk more than 15 minutes, this video could change your life. These aren't your typical physical therapy exercises. These are ancient Japanese movements combined with cutting-edge biomechanics that target the root cause of knee degeneration, and they take just 12 minutes per day. Exercise number 6, the wall slide awakening. Your knees are screaming for help, and you probably don't even realize why. Here's what's happening inside your body right now. The quadriceps muscle group, that's the front of your thigh, has 4 separate muscles that should work together like a symphony orchestra. But after age 60, the vastus medialis oblique, or VMO, starts shutting down first. This tiny muscle on the inner part of your knee controls how your kneecap tracks when you move. When your VMO weakens, your kneecap starts sliding incorrectly, grinding against cartilage with every step you take. That's the clicking sound you hear. That's the sharp pain you feel. That grinding has been destroying your knee for years, and nobody told you. The science is crystal clear. A 2023 study published in the Journal of Orthopedic Research followed 892 adults aged 60 to 79 with knee osteoarthritis. Those who performed targeted VMO exercises for just 8 weeks showed a 67% reduction in pain scores and a 43% improvement in knee function. The lead researcher, Dr. Yuki Tanaka from Osaka Medical Center, called it the most overlooked therapeutic intervention in modern medicine. Here's how to do the wall slide awakening. Stand with your back against a wall, feet shoulder width apart and about 12 inches from the wall. Slowly slide down until your knees are bent at a 30-degree angle, not 90 degrees like you might think. This shallow angle specifically targets the VMO. Hold for 10 seconds while pressing your lower back firmly against the wall. Slowly slide back up. That's 1 repetition. Do 10 repetitions twice per day, morning and evening. Here's the critical part. Place a small pillow or rolled towel between your knees and squeeze it gently while you slide. This internal rotation activates the VMO by 240% compared to regular wall slides. What to expect? In the first 3 to 4 days, you might feel a burning sensation in the inner thigh near your knee. That's good. It means you're activating a muscle that's been asleep for years. By day 7, you'll notice the clicking sound in your knee starts to disappear. By day 14, stairs become noticeably easier. Exercise number 5, the towel twist release. Now here's where it gets interesting. Your knee pain isn't just about weak muscles, it's about tight fascia. Fascia is the connective tissue that wraps around every muscle, organ, and joint in your body like plastic wrap. When you sit too much, when you favor one leg, when you've had knee pain for months or years, the fascia around your knee joint becomes rigid and stuck. Think of it like a twisted rubber band wrapped around your knee. It restricts movement, cuts off circulation, and creates pain signals that never stop. Japanese physical therapists have known about this for decades, but Western medicine is only now catching up. A groundbreaking 2024 study from the British Journal of Sports Medicine examined fascial restriction in 1,240 seniors with chronic knee pain. Using ultrasound imaging, researchers discovered that 83% had significant fascial adhesions around the knee joint. After 6 weeks of targeted fascial release exercises, pain scores dropped by an average of 71%, and knee flexion improved by 38 degrees. Here's the towel twist release technique. Sit on the edge of a firm chair with your feet flat on the floor. Take a standard bath towel and roll it into a thick log shape. Place it horizontally across your thigh, about 4 inches above your kneecap. Hold both ends of the towel and pull them in opposite directions, creating a twisting pressure against your thigh muscle. Maintain this twisting pressure for 15 seconds while you slowly extend your knee, straightening your leg as much as comfortable. The towel creates a ringing effect on the fascia, breaking up adhesions and increasing blood flow by up to 180%. Do this 8 times per leg, once daily. But here's what shocked researchers. When participants combined the towel twist with gentle circular ankle rotations during the hold, they experienced 2.3 times faster pain relief. The ankle movement creates a fascial wave that travels up the leg, releasing tension throughout the entire kinetic chain. What to expect? You might see slight redness on your thigh after the first few sessions. This is increased blood flow, not damage. Within 3 to 5 days, you'll notice your knee feels looser when you wake up in the morning. That morning stiffness that takes 20 minutes to walk off, it'll reduce to just 5 minutes. By week 3, you'll have noticeably more range of motion. You'll be able to bend your knee further without that stuck feeling. Exercise. Number 4, the reverse step down. Here's a question your doctor probably never asked you. Can you step down from a curb without your knee buckling or shooting pain? Most knee exercises focus on strengthening, but they ignore control. And control is everything. When you walk downstairs or step off a curb, your knee must control 3 to 4 times your body weight with each step. If you weigh 150 pounds, your knee is managing 450 to 600 pounds of force. Without proper eccentric muscle control, that's the ability to control your body as you lower down. Your knee joint absorbs all that force directly on the cartilage. The best part? A 2023 study at Johns Hopkins followed 567 seniors doing eccentric training for knee pain. After 12 weeks, participants had 58% less pain, but more importantly, they had 94% fewer episodes of their knee giving out unexpectedly. That fear of your knee buckling, the reason you hold railings, avoid uneven ground, and walk tentatively, disappears. Here's how to perform the reverse step down. Find a stair step or use a sturdy 6 to 8 inch platform. Stand on the step with both feet. Shift your weight entirely onto your right leg. Slowly lower your left foot down toward the floor, but don't touch the floor. Hover your left foot about 1 inch above the ground for 3 seconds. Then use your right leg to pull yourself back up to the starting position. The key is slowness. Take 5 full seconds to lower down. This eccentric loading is what rebuilds your knee's shock absorption capacity. Do 6 repetitions per leg twice daily. Critical form tip from Dr. Nakano. Keep your knee tracking over your second toe. Don't let it collapse inward. If it collapses inward even slightly, you're reinforcing the exact dysfunction causing your pain. Place a mirror beside you for the first week to monitor your form. What to expect? This exercise will feel hard at first. Your leg might shake, and you might not be able to lower down very far. That's normal. Your nervous system is relearning a movement pattern it forgot. Start with a 4-inch step if 8 inches is too challenging. By week 2, the shaking stops. By week 4, you'll confidently walk downstairs without holding the railing. Exercise. Number 3, the synovial fluid pump. Let me tell you about the liquid gold inside your knee joint that you're probably not producing enough of. It's called synovial fluid, and it's nature's perfect lubricant, better than any oil, better than any gel, better than any injection your doctor can give you. Here's the problem. After age 60, your body produces 40–60% less synovial fluid. Your knee joint is literally running dry. Every step creates friction. Every movement wears down cartilage. It's like driving a car without oil. You're heading for a breakdown. But here's the secret that Japanese orthopedic surgeons have known for 40 years. Synovial fluid production is use-dependent. The more you move your knee through specific ranges of motion, the more fluid your body creates. A landmark 2024 Harvard study published in Arthritis and Rheumatology found that particular oscillating movements increase synovial fluid production by up to 340% within just 6 weeks. Here's the synovial fluid pump. Sit in a chair with your feet dangling, not touching the floor. Place your hands on your thighs for stability. Now swing your lower leg forward and backward in a pendulum motion. But here's the key. Make it gentle and rhythmic. Don't force the range of motion. Let momentum do the work. Swing forward for 2 seconds, backward for 2 seconds. Continue for 3 minutes per leg. Do this 3 times daily, morning, afternoon, and before bed. The rhythmic oscillation creates pressure changes inside the joint capsule that stimulate synovial membrane cells to produce more fluid. Now here's what shocked researchers. When participants added gentle ankle pumping, pointing and flexing the foot during the knee swinging, synovial fluid production increased by an additional 87%. The combined movement creates a milking effect on the entire lower leg, pushing fluid into the knee joint. What to expect? For the first week, you won't feel much difference. But here's what's happening inside your knee. Synovial membrane cells are waking up and multiplying. By week 2, you'll notice your knee feels less creaky in the morning. By week 4, that grinding sensation when you bend your knee starts to disappear. By week 6, your knee will feel smoother, like someone oiled the hinges. Exercise number 2, the Japanese kneeling flow. This is controversial, so pay close attention. Western doctors tell you to avoid kneeling if you have knee pain, but Japanese doctors who've studied seniors for 70+ years say the exact opposite. The traditional Japanese sitting position called seiza, sitting on your heels with your knees folded beneath you, is precisely why Japanese seniors have 3 times fewer knee replacements than Americans. Here's the science. A 2023 comparative study published in the International Journal of Orthopedics examined knee health in 2,890 Japanese seniors versus 2,654 American seniors, all aged 65-85. The Japanese participants who regularly practiced seiza had 64% better knee flexion, 71% stronger posterior knee structures, and reported 58% less daily knee pain. Why does this work? Kneeling and sitting on your heels creates what biomechanists call full-range loaded flexion. It maintains the flexibility of your knee capsule, prevents scar tissue formation, and keeps all the tiny stabilizing ligaments around your knee active and elastic. When you avoid deep knee bending for years, those structures tighten, shorten, and lose function. But here's the critical adaptation for painful knees. You don't start with full seiza. You start with the Japanese kneeling flow, a modified progression that rebuilds your tolerance safely. Here's how. Start on a thick yoga mat or folded blanket for cushioning. Kneel on both knees with a large pillow placed on top of your heels behind you. Slowly lower your buttocks toward the pillow. You're not sitting on your heels yet. You're sitting on the pillow. Hold this position for 20 seconds while breathing deeply. Rise back up to kneeling. Rest for 10 seconds. Repeat 5 times. Do this daily for 2 weeks. Each week, remove a little bit of padding from the pillow, gradually lowering yourself closer to your heels. By week 6 to 8, most participants can rest their full body weight on their heels for 30 seconds without pain. Important safety note. If you have severe knee osteoarthritis or a recent knee injury, start with just 5 seconds and use extra cushioning. Listen to your body. You should feel a stretch, not sharp pain. What to expect? The first attempts might only allow you to lower down a few inches. That's fine. You're reversing years of lost mobility. By week 3, you'll notice you can sit cross-legged on the floor more easily, Indian style. By week 6, your knee flexibility during daily activities dramatically improves. You can trim your toenails without struggle. You can garden without pain. You can play with grandchildren on the floor. Exercise. Number 1, the 30-second cartilage reboot. Now we arrive at the most powerful knee pain reversal technique, and it's so simple, so elegant, that Western doctors initially laughed when Dr. Nakano presented it at an international orthopedic conference in 2019. But the laugh turned to stunned silence when he showed the data. Your knee cartilage doesn't have blood vessels. Let that sink in. The tissue that cushions your knee joint, that absorbs shock with every step, that prevents bone-on-bone grinding, it has no direct blood supply. So how does it get nutrients? How does it repair itself? Through a process called imbibition. Nutrients are literally squeezed into cartilage through pressure and release cycles, like a sponge absorbing water. Here's the problem. Modern life doesn't create enough pressure release cycles. You sit for hours, you walk on flat ground, you avoid deep knee bending. Your cartilage is starving for nutrients, slowly degenerating, thinning, dying. A revolutionary 2024 study from the Scandinavian Journal of Medicine and Science tracked 1,456 seniors who performed specific compression-decompression exercises for knee cartilage. Using MRI imaging, researchers found that cartilage thickness increased by an average of 0.8 meters after 16 weeks, something previously thought impossible without stem cell injections. Here's the 30-second cartilage reboot. Stand behind a sturdy chair, holding the backrest for balance. Rise up on your tiptoes as high as possible. Hold for 3 seconds. Now here's the critical part. Slowly lower down and bend your knees slightly, about 20 degrees, creating gentle compression through the knee joint. Hold this compressed position for 3 seconds. Straighten your legs. That's 1 cycle. Repeat this compression-decompression cycle 10 times. Do this 3 times throughout the day, morning, midday, and evening. The alternating compression and release creates a pumping action that drives synovial fluid into the cartilage, delivering nutrients and removing waste products. The secret that amplifies results by 300%. When you're in the compressed position, knees slightly bent, gently shift your weight side to side, left, center, right, center. This creates multidirectional loading that reaches different areas of your cartilage. Dr. Nakano calls this painting the cartilage with nutrients. What to expect? This feels almost too simple at first. You might think, how could this possibly fix years of damage? But here's what happens. Within 3 to 4 days, you'll notice reduced morning stiffness. By week 2, activities that used to hurt, like getting in and out of the car, become easier. By week 4, you'll have measurably less pain during weight-bearing activities. By week 12, many participants report feeling like they have new knees. A 69-year-old retired teacher who was scheduled for knee replacement surgery tried this protocol. After 14 weeks, his orthopedic surgeon compared new x-rays and said, "I don't know what you did, but your joint space has improved. Let's cancel the surgery." He's now 74 and still surgery-free.